Hi all, good afternoon. Dr. Salim Parvez from Kolkata here. So today I am back with my third block of non-surgical treatment option of backache available in Kolkata. Thank you very much for the overwhelming response of my two previous blocks. Now just to continue in this series, let me just brief out like what exactly I am telling, what I told you in the previous two of my lectures or the blogs. Now what is this actually, what is this procedure like? Now this is actually a treatment option for back pain, which even includes the cervical as well as the dorsal disc, the lumbar disc as well, the whole of the spine. And the patient who are included in this are the patient with non-surgical disc, means that small disc, or the patient with a larger disc who are actually the surgical candidate but not fit for surgery due to some reason. And third are the post-op patient who are still having the symptoms or the pain. They are not willing for the second surgery or whatever reason. So which is called the fail back syndrome. Now what are the two options? Just briefing the two options, two ways how you give this injection are the CT guided as well as the C-arm guided. We have both the option. We do through both the options, but we prefer giving under CT guidance. Now block under CT guidance, and the reasons already I had told that because of high soft tissue and the bone differentiation, the injection site or the drug delivery is very accurate. Second thing, it's a low cost, cheap procedure. Third is it's a walk-in OPD procedure, so you can just take the injection, walk in, and be out. Now, thank you very much for the two blogs. I got so many questionnaires. Different people are asking me different type of questions. So let me discuss the questions what the people had given, what they had raised. They had asked me in my personal number, and so that I can share with everyone, so that the things can be clear to each and everyone whoever is going through this uh, my lecture or my session. Now, first question, the commonest question what I got was, who are the candidates? Who are the candidates for this particular procedure? Who are the candidates? So what I say is, everyone is a candidate for this procedure because everyone has got a backache somewhere, sometimes in the life, which makes your life difficult. The quality of life is suffered. So everyone is a candidate. Now the second thing is, and out of this backache, as I told you earlier, there are the three categories whom we choose. One is the small disc, not responding for the conventional treatment. Second is the patient who are surgical candidates but not getting surgery done. Third are the post-op patients or the failed back syndrome who are still having the symptoms. The second question what I got from the maximum people is, how do we decide? Like, how will you decide who are the candidates for this particular thing? So we decide on the basis of MRI. So for any patient who's coming with a symptom which is a radiating symptom, or we call it neurological symptom, when MRI is done or the patient come with the MR, we see the size of the disc, we decide the size of the disc. If it's a huge chunk, it's always preferred to go for a surgery depending on the site, and so many things have to be there. So for this type of patients, we refer the patient to a neurosurgeon, orthopedician, or a neurologist, depending on those, on the type of disease, on the type of problem, and we refer that thing. So we are having a team of people who are into this. Now, so after choosing, after seeing the MR, the patient is being chosen, and then we go ahead with this particular procedure. Second thing, the next question, what was the commonest, was the duration of stay. Duration of stay is, we say it is 2 to 3 hours after taking the injection. Before that, we prepare the patient. That takes some time. So come with hand around 3 to 4 hours, because we keep you here. We keep you for observation for 2 hours, and then we discharge the patient. The next question, which was the commonest thing, was the efficacy of this particular procedure. How much efficient is that procedure? How much uh, pain relief you get that thing? So till now we had got most of the patient, they get relieved on table. Usually before giving this injection, we tell the patient that the patient will be symptom free for 3 to 4 months. There can be possibility of the pain coming back again. So probably, if not again in the second MR or something, if the patient is not fit for the surgery, we'll have to take second injection. This can happen. This is what we tell everyone. But as per my experience till now, I'd never got a patient coming back to me for a second injection. Usually they get relieved with this thing. Along with this, we prescribe some medication, slowly some physiotherapy. So this is how we build the patient. The backache is taken up. So we haven't got any received, and we haven't received any patient back to us. The other question, the commonest question is this something new? Is that some new procedure? So no, it is not a new procedure. This has been practiced for last few years, so many years. It is usually done under C-arm guidance by many people, many astute the people they do that thing. We prefer doing it under CT guidance because of so many benefits of the CT. As I told you, excellent soft tissue contrast, differentiating between the bone, the disc. Even we inject few of the facets sometimes when we get the facetal arthropathy. So in a single go, we do all those things. So we do under CT guidance, and I prefer doing that thing in CT guidance because of so many reasons. Already had elaborated the reasons for that thing. Anyway, we offer both the options, but this is as cheaper. Guided injections are cheaper. Daycare procedure, just walk in and get the injection and go out. And accuracy, the most important thing is the accuracy. There is hardly any chance of nerve root injury, because you see the nerve root, you see the bones, you see the muscles, you see the fat, everything is visualized, everything is on table. So these were the queries which I got, and thank you very much everyone for your overwhelming response for my blogs. In case of any other questions, any other queries, if you want to have with me, you are most welcome with that. My number, it is being flashed here on the screen. Thank you very much. Take care. Bye bye.